Well, hello, and thank you for joining us for today's webinar, Boosting Staff Efficiency, Making the Most of Your Team in a Digital First Healthcare Organization. I'm Adam Rubenfire, a content manager at Phreesia, and I'll be moderating today's presentation. Today, we'll offer best practices for using automation to support staff, avoid waste, and improve employee retention. Before we get started, I'd like to quickly share some housekeeping notes. Attendees can submit questions at any time using the Q&A widget, and I'll ask as many questions as time allows. In the resource widget, you'll find a one-page overview of Phreesia, a blog featuring 4 ways to improve staff efficiency, an infographic about healthcare's top 6 efficiency killers, and a white paper about how you can best manage the staffing crisis. And to learn how you can use Phreesia and the Patient Activation Measures Survey to deploy staff more effectively, you can also check out our case study with HealthLink, a federally qualified health center. If you have any technical difficulties, please don't hesitate to reach out. We'll try our best to help. And since it's always one of the most frequently asked questions, this session's being recorded and you'll receive a link by the end of the week. Now, our session today is going to start with a quick introduction of our guests in Phreesia. Then we'll discuss why so many organizations are adding automation to support their staff. We'll offer some ideas for where your organization can apply automation to save staff time. And finally, we'll spend the majority of our time in a panel discussion with our guests. We encourage you to send in any questions you have for them that you may have throughout the webinar, and we'll get to as many as we have time for. Speaking of our guests, I'm thrilled to introduce them. Justine Davis is practice administrator at Burke Family Practice, a 10-provider practice in Burke, Virginia. Justine has worked in healthcare for over 30 years with a wide-ranging skill set, including software and billing consulting, along with EHR sales and implementation. Jennifer Thomas-Roloff is practice manager at Gwinnett Pulmonary Sleep, which has 5 locations and 16 providers. Jenny has worked at the organization for 16 years, starting as a receptionist. She's a certified medical practice executive, a CMPE. We're thrilled to have you both here today. Thank you so much for joining us, Justine and Jenny.
Thank you for having us.
Amazing. Well, just a few brief words about Phreesia. Phreesia is guided by our mission of creating a better, more engaging healthcare experience for patients, providers, and staff. At over 120 million visits annually, that's over 1 in 10 across the US. Our digital platform helps healthcare organizations enhance the patient experience, drive efficiency, and improve healthcare outcomes. We've got real-time integrations with all the leading EHRs and registration, scheduling, and billing systems. We're a publicly traded company on the New York Stock Exchange, and we've been rated #1 in patient intake management by the research and insights firm KLAS 4 years in a row. Our security and privacy efforts are recognized with the industry's top certifications. If at any point during this webinar you're curious about how Phreesia can help you improve staff efficiency and support your team, please fill out the request a consultation form using the dropdown on the right-hand side of your screen. We'd love to discuss how we can help. But enough of all of that. Let's get right into the presentation. So, many of you may have thought about adding technology to automate certain tasks at your organization. But where do you start? Well, highly structured roles in predictable environments are good candidates for automation. In healthcare, that means many of the tasks that our front desk, scheduling, and billing departments perform are ripe for automation, as they're often repetitive and manual and take significant time for staff who could be focusing on the patient experience or other higher value tasks. So that's going to include intake tasks like data entry and consents. Having staff transcribe paperwork or scan consents, it's just not a good use of their time. When patients complete intake themselves and sign consents digitally, data is more accurate and consent management is streamlined. Staff don't have to worry about when a patient is due to renew consent. It also includes revenue cycle management tasks, such as eligibility and benefits verification and patient payments. It's really inefficient to have staff make calls or manually check E&B for each and every patient. An automated E&B verification tool can check multiple times prior to a visit to ensure a patient is covered for their appointment, so that staff only have to get involved if there are issues with the patient's status. We know this is a pretty big pain point for a lot of organizations. Automated payment reminders and online payment tools, also a part of that revenue cycle. They make it easy for healthcare organizations to collect from patients without forcing staff to call them repeatedly. Online appointment scheduling can help reduce inbound call volume and let patients schedule when your office is closed. A smart scheduling tool can automatically fill unexpected gaps on your schedule due to cancellations and rescheduled appointments that would otherwise take significant staff time. A smart scheduling tool can do that without any waitlist signups, apps, portals, or staff work required. Waitlists are inefficient and time-consuming. Some organizations, for that reason, just don't even have them. But a smart scheduling tool can quickly and automatically recapture lost revenue. Finally, digital screening for social and clinical needs is a great way to not only save you and your staff time, but it also improves outcomes. Research shows that patients are more honest when screened digitally, and by having patients complete screenings prior to the visit, we can enable more meaningful, informed conversations in the exam room between providers and their patients. Now, I'd just love to share just a few data points that show just how significant an impact automation can have on healthcare organizations and their staff. A University of Oxford study found that nearly half of the administrative tasks performed in medical practices could be automated to save staff time and help them do their jobs better and smarter, I should say. Phreesia's own data shows that staff save 5 minutes for every patient that checks themselves in, freeing them up to perform higher value tasks. We'll discuss what kind of tasks may be higher value for your organization on the next slide. Automation can also help with claims denials, which can cost your organization time and money. Over 50% of claims denials are due to breakdowns on front-end processes such as registration, patient eligibility, and data accuracy. When we allow patients to provide their own information and streamline E&B checks, we can get ahead of denials due to inaccurate information or inadequate coverage. It can be a significant, costly problem. And finally, if you're wondering just how costly denials and manual eligibility and benefits checks can be, a CAQH report found that the industry could save a whopping $9.8 billion if every healthcare organization switched to electronic E&B checks. So we've clearly outlined that automation can save your staff time, but what could you do with that saved time? First and foremost, we find that many healthcare organizations are just simply using automation to fill staffing gaps. They're trying to maintain the level of service that patients expect amid significant labor shortages. They're trying to get to, what used to be the status quo. In May, the latest month for which data is available from the Bureau of Labor Statistics, the healthcare industry had among the highest number of job openings when compared to other sectors, with 1.7 million open positions. In April, there were over 2 million job openings, demonstrating that filling staffing gaps, it continues to be a significant struggle for healthcare organizations. Now, at a time when it can be difficult to hire staff, technology can help take the burden off your team and handle manual and repetitive administrative tasks so you and your colleagues aren't stretched thin and you don't have to spend significant time and money trying to hire additional employees because most of the executives we talk to say it's near impossible to fill all the gaps. But beyond filling those gaps, what higher value tasks could administrative staff perform when automation is handling certain workflows? I'd love to hear your ideas in the chat. Send them in. We'd love to hear, how you think, what kind of tasks you could get to when technology could help fill some of those manual repetitive workflows. Here's some we've been thinking of. So, staff can spend more time boosting appointment volume by developing marketing campaigns, thinking strategically about how your organization can acquire and retain patients. They can spend more time with patients, walking them through their experience and providing a pleasurable experience so that they return. They can focus on working with payers to get reimbursed. Rather than spending time chasing down patient financial responsibility, staff can spend their time getting the higher dollar value reimbursement from insurers. And finally, they can spend more valuable time training other staff and learning new skills that can improve your practice. So all of these tasks and more, I'm sure that you're going to be sending us in the chat. I'd love to see those are a better use of a staff time and use you and your employees at a higher skill level than data entry and other structured, predictable work that can be automated. We want to make the most of our employees' time and make them feel like we're using them for their fantastic skill set. So with that, I'm going to move right into our Q&A. I will drop down our PowerPoint here so we can see our panelists' lovely faces. So, audience, if you have questions for our panelists, again, send them in via that Q&A widget on your console. If we don't get to your question today, we'll be sure to follow up after. I want to start by asking our panelists to share a little bit about their practices, their organizations, your facilities, the patients you serve. Jenny, would you like to go first to tell us a little bit about
Sure.
where you work?
Sure. Yeah. Work for Gwinnett Pulmonary Sleep. We are a large private pulmonary sleep and critical care medicine practice. Actually, this month we are 18 providers now.
Excellent.
So we're growing. Four, 5 offices, 2 that we're in, full time, 5 days a week, full staff. Yeah, we serve all kinds of patients, sleep apnea patients, asthma patients, COPD patients. We have a good variety of patient demographic coming through our doors.
Excellent. Justine, what about you? Let's hear about your organization.
Yeah, thanks for asking. So we're a mid-sized family practice in Northern Virginia. We actually have 11 providers now, including 5 doctors and 6 nurse practitioners. We see about 120 patients a day, but couple that with our on-site phlebotomy lab that services up to about 60 patients per day. I have 30 staff with 7 of them who are administrative front desk, who actually are the members who use Phreesia the most. We're seeing patients who are 1 day old up until the very end of life scenario. We've got men, women, children. We see them for all sorts of disease models, including wellness care. And so we have a very large population of patients that we see on a daily basis.
Wow, super exciting. Very interesting. Jenny, I'll come back to you for the next
Sure.
question we have here, which is, we're going to talk about, like we said, kind of what are you doing with that time you save with technology? But let's start about talking about where we're using technology. Where have you deployed automation or self-service technology at Gwinnett Pulmonary and Sleep to save staff time?
So we actually use a couple of different Phreesia products. So we have intake, check-in. We use Phreesia Connect for our referrals, getting patients in the door. It's a great tracking system. It's a lot less labor intensive for faxes and all that. And then we also use Appointment Accelerator, another Phreesia product to help us manage not a wait list, because to be honest, nobody can do a wait list. It's too much work. But Phreesia has been great with filling those gaps in the schedules for cancellations, getting patients in sooner. We do have about an 18-day wait for new patients right now. So it's a huge service for our patients to be able to, they get a text, hey, we have a sooner appointment, and that to just go on in the background. And it really has been a great time saver for our staff and for our schedules, productivity.
That's fantastic. Yeah, I know you mentioned to me previously that it helps with that high call volume too, bringing that down so
Yes.
that patients can do things themselves and keep your staff focused on more important tasks. Justine, what about you? Where are you deploying automation at your organization and self-service technology? How are you saving your staff time?
Yeah, so as you said in the beginning in my intro, my background has been electronic medical record implementation, along with practice management and billing consulting. So even with our Athena EHR that we use, I'm constantly developing and tweaking known workflows within Athena to continue to improve efficiencies. We are a family practice. We are part of an affordable care organization called Phreesia Medical Group. So we are also, inclined to do more quality measure type of things with preventative screenings and questionnaires. And so Phreesia, we employed, we're newbies to Phreesia. We just celebrated a year, so we're not as fancy as Jenny's group, but we are looking into the other programs that Phreesia has to offer. We use the intake, and the intake for us at this moment works really well. One of the reasons I brought Phreesia in was because we are family practice. And so we did have a large population of sick and COVID-related symptoms and patients. So I was able to remodel our entire practice. I added its own sick exam room. I added 4 exam rooms last year, hired new doctors. And now we utilize Phreesia as a waiting room for our patients. And we execute that with using the text feature. And so we've also automated all of those check-in processes, because we are heavy on phones in terms of scheduling. We do complex scheduling to get it right on the first call. So if we have more time to do that using Phreesia, we're at about a 90% response rate for our patients who utilize the program. So I'd say we're doing really well, but it has definitely enabled us to automate pretty much everything. And it's just made such a difference in just the year that we've been using it.
That's so interesting how you're kind of using your space more effectively, because you've implemented technology. That's really interesting. Justine, I'll stick with you.
Great.
So now that you've mentioned a little bit about how you have remodeled and that kind of thing. Tell me a little bit about, because staff, aren't don't have to be as involved in check-in, because patients are doing it themselves, because different things like that have been automated. Where do you get to use your staff? What types of projects or processes are you applying them to, because they're not, manually checking
Yeah, so
things?
that's a great question. So, I mean, Phreesia does allow for us to do more with less in any given situation. However, it doesn't substitute for a valuable employee that we need for those types of things. It's helped us just even reduce burnout. They enjoy using this simplified program and they don't have to spend all this extra time. I have a smaller waiting room. My check-in and my checkout process needs to go quicker because like I said, we could see anywhere up to 150 to 160 patients a day. We got to move them in, we got to move them out. There's a sense of satisfaction when we see those green check marks. Thank you so much for doing the check-in. And we know that the patients are also engaged. And so it's just made life a lot easier. Our staff are able to make better phone calls. Our staff are able to do more of the ancillary tasks associated with Athena. They're able to work closely with providers on any issues. The time of service collections went through the roof. We're up about 45% in our time of service collections in just the years that we've been using it. It's helped us. We don't have to do insurance cards anymore. We don't have to, do the forms on paper. There's just a lot of job satisfaction now using Phreesia.
That's fantastic. Jenny, what about you? How are you deploying? I mean, you've been with us for quite a bit.
Yeah.
But how does having technology change the way that, you deploy staff versus if you didn't?
Well, so with Phreesia, we started with intake. Then we did appointment accelerator, and then our newest platform, and I think we're on with Phreesia, is Phreesia Connect. So for instance, on Phreesia Connect, we use that a lot for our ancillary services and sleep. We have a lot of providers that order just sleep studies with us for patients. And, that was basically a manual process where they would fax an order form to us, and we'd have these huge stacks of paper that if somebody called back to schedule, we're going through huge stacks of paper trying to find that patient's order.
Awesome.
So with Phreesia Connect, it keeps it all in a great searchable database. So when I actually, unfortunately, had one of my sleep girls leave to pursue school and another career, I didn't have to replace her, which was great. We were able to manage with the staff that we had. As far as, front desk staff goes, they have more time with patient interaction. They have more time for that, personalized service instead of them being so consumed with the patient's check-in and intake and getting all the information. There's more time for that great conversation, patients walking in the door with the front office staff instead of having to go, is this your insurance? Can you sign this form, do all this? So in those aspects, Phreesia has been great with us, bringing us that personal touch back with our patients.
Jenny, do you think that's something, Justine talked a little bit about burnout. Do you think that is something that folks who get into the front office as a job, do you think that's something that they value? Is that being able to do that? Do you think
yes.
that's important? Tell me a little bit about that.
Yeah, I think it's important. I mean, our providers the provider that started the practice 40 years ago, and he's still practicing in the practice today.
That's
and
true.
Yeah, some of our patients have been patients for 20 years. I mean, they're like family. I have one that'll just come in, walk back, and give all the girls at the front desk a hug. That's valuable. You create these relationships with these patients over the years that, we don't ever want them to feel that they have less service, and we have a lot of older population patients too, who are like, what is this? Why do I have to do this? I don't want to do this. But once they got used to it and they've done it, they realize the value. Their waiting time's less. They get more of that personalized service because our front desk girls aren't bombarded with phones and forms and paperwork. So I think it's very valuable to our practice.
And I'll agree with Jenny on all of those points in terms of the more personalized interactions with patients have now sort of returned, and patients can see that and they appreciate that very much. So great point, Jenny, on that.
That's fantastic. Justine, I'll stick with you because one of the things Jenny said was Jenny mentioned that someone unfortunately left, but she didn't have to replace them, which is important because, like we said, it's hard to hire right now.
Mhm.
Have you seen that, Justine, at your organization? Have you been able to lessen the impact of staffing shortages, reduce like hiring costs? I think you actually said to me that sometimes you're filling gap, have to fill in at the front desk, right?
Well, I'm definitely a full service practice administrator, but I will
Me
tell you,
too.
I will be, yeah, Jenny too. I mean, I will be honest right now. I am 2 staff members down at the front desk for reasons, very difficult to find replacements, and we're doing okay. Yes, we're working a little bit harder, but we're working smarter, and we're using Phreesia, and we're using our technology, and our staff are, doing really well together. Like I said, we do more with less, and we do it with a smile on our face. And, like today, I was here at 6:30. I was at the front desk. I was doing check-in and check-out, and I had a ball because I was with my team, and I get to see Phreesia in a different light. I accidentally checked somebody in incorrectly. I was able to correct it really quick. I mean, these are things that we all sort of, we're a great team, and I think utilizing Phreesia has been a big part of that. And I will be the first to tell you it's really enhanced our practice in a lot of different ways.
Great, that's great. I mean, hopefully it gives you also the opportunity, because you're doing this, that you can think. Do you feel like you can think a little bit more strategically? Yeah, I mean, I'm sure you both are lovely at the front desk and love interacting with patients, but you're both practice administrators.
Yeah.
Do you think it's important to be able to use technology so that you can step away and be able to do, to be able to think strategically, Jenny? I mean, is that an important thing for you?
Yeah, I definitely think it is. I do my share of fill-ins at front office, when there's a need, you're the practice admin, you're going to step in. But I also think that it's very important for practice administrators to use that technology and know how to use that technology. Because if you, as a practice admin, if you don't know every workflow in your practice, you're doing something wrong. So I feel like it's very valuable, especially when I get all these great ideas for new technology and my providers are like, really? Again, I think it's very important that you know it inside and out, you know how to do the job, because then I feel like your team, I don't know, they trust you more, they rely on you more, it's a sense of, oh, well, she does it too. She gets down in the trenches with us too. So I think it's very important all around.
Yeah, and I might add to that in that, I put this out to my staff. Hey, listen, I'm going to bring in this software, but you're going to be the ones using it. You guys get to develop the workflows. You tell us how it works, what works best, what doesn't work. And they actually have been collaborating with me this entire time on figuring out what the best workflows are. So I don't just go, here, this is what you're doing. They tweak it along the way. And now we use it really well every day. And, it's also a really good program when you do make mistakes. You can self-correct pretty easily.
And I think that actually leads really well into this next question I have here, which is, what advice do you have for talking to employees about automation? I think naturally, especially in the age of AI, we get a little shaky sometimes about the word automation and about technology, and people. So I would love to talk about how you talk to employees about software like Phreesia, but really any kind of software where we're talking about automating certain tasks. Jenny, let's start with you.
Sure. I guess the most recent conversation I had was with Phreesia Connect, the referral. That it was definitely a hard sell for my sleep staff. Um, they've been doing it one way for almost 20 years, so you're kind of like rolling in there. But I think making it a positive collaborative effort, like Justine was saying as well, we're going to try out this software. Phreesia is great because they give you trials on everything, and it's fabulous because you get to kind of use it in the real world before you commit to something. And we tried it for 3 months, and my staff was absolutely ecstatic about how great Connect worked as far as streamlining their workflows with the referral process, being able to keep great track of first call, second call, third call scheduled, or and keeping in contact with the referring providers. That's huge. They don't have to worry about faxing off a sheet, we couldn't get this patient scheduled, or keeping the referring providers updated. It's a quick message, or the referring providers can look at our portal and see that their patient's been called and scheduled and completed. So I think that making it a collaborative, we're going to try this. If it helps your workflow, if it improves processes, great. We'll go from there. If not, we'll see how we need to tweak it to make it better.
Jenny, I think one of the things you've told me in past conversations as well is that, articulating that it helps you provide more efficient care and increase quality of care.
Right.
Do you find that like it's important to like appeal to your employees' like sense of purpose and mission in what they do?
Oh yeah, of course. And especially in that situation where it comes to, the referring providers, I think appealing to them, the patient's getting taken care of faster, they're getting in faster. And just that those referring providers, which is, our livelihood as a specialist practice. I mean, we have nothing without our patients and the referring providers that, send patients to us. I think keeping them happy and engaged, that is definitely a huge selling point. And they're doing something that's for the patients, getting them in sooner is the biggest thing, I think.
That's great. Justine, what about you? How, you've been working in software implementation for some time now. How do you talk about automation with employees?
Yeah, so as an employer, when I'm speaking to employees, because of all the software implementation I've done and how healthcare is all about electronic medical record and improving workflows and things like that, I always ask someone, well, what are the electronic health records that you've used? And I explain to them that those are skill sets that you will be able to transfer with you. And now how cool, we have this other software program that's just going to add to your skill set. That's a lot of fun to use, and it makes things efficient. And, you get this sort of, rah-rah routine, like selling them this program as though it's going to be the greatest thing. They're coming from an office that had a very outdated practice management system where they didn't. I'm even meeting people who come from a paper office who don't understand the importance of electronic health record in this business and what it actually does. So I not only teach them how to use the programs, I teach them why it's important and how everybody is connected from the front desk to the providers to the billing, and everybody is a part of that patient experience and how important that is. And so that's kind of how I sell it to my employees.
That's fantastic. We've got time for one more question here. So kind of a sum up, for a healthcare organization that wants to start this journey tomorrow, that wants to start automating at least some of their tasks to kind of relieve that staff burden, what's your biggest piece of advice? Where do they start when it comes to implementation and staff alignment, as we've been discussing? Jenny, I'll start with you.
Sure. Well, I think the biggest starting point is identifying your processes that need to be improved. That, you could have patient complaints, nobody answers your phone, or wait times, that sort of thing. Definitely looking through all your processes you have and deciding which pain point needs more efficient technology to move you forward. And of course, the buy-in from your providers is the biggest here, the higher ups. But definitely speaking on those points with the providers, I would say, improve revenue, fill schedule gaps, increase patient satisfaction and experience. Those are those top topics that those providers love to hear. And I think that's where you start. And then once you figure out which process is going to be more efficient with technology, working with your staff on, gaining buy-in, that collaborative effort, I think that's probably the easiest part.
That's great. Justine, what about you?
Yeah, so I would say for any organization who feels there's just no time to implement yet another thing, most especially after coming out of this 3-year global pandemic where it's really hard to hire staff, I would say let Phreesia guide you through the process. They assist you in figuring out all of your workflows, and it's a good time to find the flaws that need fixing, your pain points, as Jenny pointed out. They help you build the processes for you. Their support team stays behind you well beyond your implementation. You get your staff excited about the process. Let them help with the collaboration. You never know, someone on staff might be waiting to become a star who wants to be your champion, who really wants to embrace this. And, these are skills that will translate whether it's within or outside of your organization. But, the price is right. You can get it done. It's a little scary, but I'll tell you, a year later, we're so happy with the program. It was worth every minute.
That's fantastic. Those are very sweet words about our support team. So thank you so much for that. It was one of the things you said that I would just love to talk about is, the fact that we do see folks who, go through implementing scheduling software with us and end up simplifying their schedule. They have got too many templates or lots of different kind of, it's good to customize, and there's definitely technology can let you do that and set rules, especially in kind of like appointment accelerator and those kinds of things. At the same time, sometimes when you do an implementation, you say, do we need all of these, different variants? So I think that was a really important point to bring up there, Justine, and I really appreciate that. Well, that's really, unfortunately, all the time that we have left today. So I'm going to go ahead and close us out here. But thank you so much, Justine and Jenny, for your time today. It's been fantastic. Audience, if we didn't get to your question in the chat, or if you have any questions about Phreesia, don't hesitate to request a consultation using the form on your screen. We'd love to be in touch. Justine, Jenny, thanks again, and have a great day.
Thank you
Thanks,
so much.
Adam.
Thank you.